This is a demonstration video for the anatomy palpation exam. Before we begin, remember to always assess the quality and condition of the tissues you are palpating. It is important to remember the draping for palpation. In the clinic, always place a sheet or a paper on the table before the patient is positioned. This is not necessary for this lab. If the patient is sitting on the table, position a sheet so it can be placed between the legs or the diaper draping. If the patient is lying on the side, position a sheet on top of bottom leg unless palpating, and place upper part of the sheet between the legs. If patient is lying on back and palpating trunk and upper extremity, place a sheet over lower extremity and cover any part of trunk and upper extremity not being tested. We will be starting with the back and pelvis. First is the standing position. You will be facing the patient at eye level with the pelvis in front of you. We will first find the anterior superior iliac spine and the iliac crest. Now you will move to the back again with your eye level with the pelvis. Here you will find the posterior superior iliac crest, or the PSIS, and the greater trochanter. When moving to the supine position, make sure to place a pillow under the knee to flex the hip and decrease the tension on your rectus femoris. Here you will find your anterior inferior iliac spine, or the AIIS. Next you will find the pubic crest. Make sure to explain to the patient what you are going to palpate and get their permission. Place the patient's heel of hand just above the umbilicus with fingers pointing to toes and your hands on top. Once they have found the position of the pubic crest, you can have them take their hand off and move your hand inferior until you feel it. The two muscles you will palpate in the supine position is the rectus abdominis and the external oblique. Next, we will move into the prone position. Find your L4, L5 interspace and then move laterally 2 inches. This will allow you to palpate the L5 transverse processes. The sacrum inferior lateral angles can be found halfway between the PSIS and the coccyx. Lastly, back up to the PSIS. Slide your thumbs inferiorly to the gluteal fold, where you can find the ischial tuberosity. The last object to find in the prone position of the back is the erector spinae muscles. Now we will move to the lower quarter. First, in the prone position, the greater trochanter, the sacrotuberous ligament, which goes from the coccyx and PSIS to the ischial tuberosity, the hamstrings, and be able to find the difference between the lateral and the medial hamstrings, the gastrocnemius and the soleus, your Achilles tendon, the gluteus maximus, and the piriformis. The piriformis can be found between the greater trochanter and where the PSIS and the coccyx meet. In the sitting position, find the medial and lateral femoral condyles, the medial and lateral femoral epicondyles, the medial and lateral tibial condyles, the knee joint line, the fibular head, the LCL, which is separate from the capsule and attaches to the fibular head. The MCL feels like a broad sheath. The pes anzarine, which is the conjoined tendons of 3 muscles that insert on the anteromedial surface tibia. The base of the patella, which is the superior surface. The apex of the patella, which is the inferior point. The patellar ligament, which is below the patella and attaches onto the tibial tuberosity. The quadriceps tendon, where the quads attach to each other and to the patella. The tibial tuberosity. The lateral and medial malleoli. The calcaneus. The head of the talus, which is slightly proximal on the medial side from the navicular tuberosity. The navicular tuberosity, which is the medial bump distal to the medial malleolus. The cuboid, just proximal to the base of the fifth metatarsal. The medial cuneiform. The tuberosity of the fifth metatarsal. The metatarsal heads 1 through 5. And the medial and lateral sesamoid bones, which can be found on the first tarsal. When looking at the quadriceps, be able to find the rectus femoris, vastus lateralis, and vastus medialis. Be able to find sartorius, go from the ASIS and the pes anserine and palpate slightly medial on the thigh. Gluteus maximus, which is a hip joint external rotator. Tensor fascia lata, which is a hip joint internal rotator. The anterior tibialis, which is lateral to the tibial bone. The common perineal nerve, which can be found directly behind the fibular head. The posterior tibial artery, which comes around the medial malleolus. And the dorsal pedis artery, which is just lateral to the extensor hallucis longus tendon. In the side-lying position, you have the hip abductors, the glute med and min, and the tensor fascia lata, which goes into the IT band. Your hip adductors, fibularis longus, brevis, both the muscle and the tendon, and your posterior tibialis tendon. Now we will move to the shoulder, arm, and thorax, starting in the supine position, the sternal notch, the first rib. To find the first rib, place thumb between clavicle and upper trapezius and push them through the scalenes muscle. Serratus anterior, which is not shown in the video but can be seen in the picture. It is felt at the levels of the armpit and a few inches inferiorly. Pectoralis minor, which is felt at the coracoid process. Pectoralis major, both the clavicular and sternal head, which is felt on the humerus and the clavicle. The triceps, and brachial artery. In the prone position, you have the scapula, and on the scapula, the spine of the scapula, the inferior angle, the medial border, the lateral border, the infraspinous fossa, and the supraspinous fossa. The 12th rib. For these following muscles, you need to make sure to stand on the opposite side of the muscle you are palpating with the head turned facing you. You have the middle trapezius, the lower trapezius, the rhomboids, and latissimus dorsi. The infraspinatus, teres major, posterior deltoid. In the sitting position, the clavicle, the acromion process, the acromioclavicular joint, the sternoclavicular joint, the coracoid process, which is 1 inch medially and inferiorly to the acromion, the deltoid tuberosity. On the humerus, the greater tubercle, the lesser tubercle, and the intertubercular bicipital groove, the tendon of the biceps brachii, long head, the brachial pulse, the lateral epicondyle of humerus, the medial epicondyle of humerus, olecranon process of the ulna, the upper trapezius and levator scapulae, shoulder abductors, which include your deltoid and supraspinatus, the biceps brachii, brachialis, brachioradialis. Now moving to the forearm and the hand. In the sitting position, the olecranon process and bursa, the radial styloid process, the ulnar styloid process, the head of the radius, Lister's tubercle, ulnar nerve, all of the carpal bones, including the scaphoid, lunate, triquetrum, pisiform, capitate, and hamate. The CMC joint of the thumb, the median nerve, the radial artery, the anatomical snuff box, which includes the abductor pollicis longus, extensor pollicis brevis, and extensor pollicis longus, the superficial branch of the radial nerve, pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris, flexor digitorum superficialis and profundus, and extensor carpi ulnaris. Extensor digitorum, extensor carpi radialis longus and brevis, supinator. Moving to the head and the neck in the supine position, the mastoid process, the zygomatic arch, the external occipital protuberance or the superior nuchal line, the mandible, and on the mandible, the ramus, the angle, the body, the ventral prominence, the transverse processes of C1, frontalis, temporalis, masseter, the temporomandibular joint, or the TMJ, sternocleidomastoid, the common carotid artery, scalenes, and the spinous processes of C2 to C7.